All right, let's get honest here. We have all felt this, the fear and the stress of visiting a dentist. But what if I told you there was a way to relieve that feeling? Well, this guy right here, Dr. Vincent Monticciolo from Monticciolo Family and Sedation Dentistry, is here with more. And this is good news for a lot of people because I, for one, and I know a lot of people who are watching, may not go to the dentist as often as they can or should because they're afraid. They don't want to have that and all of those feelings that come with that. So what kind of patient is best suited for this type of dentistry?
Yeah, what we do is IV dental sedation, and our biggest patient base would be dental phobics, needle phobics, gaggers, patients that have had past traumatic experiences at the dentist, either childhood or recently. We also see special needs, Alzheimer's, patients that have limited opening or very sensitive teeth or can't get numb. Those are the type of patients that we see or are referred to us to be sedated.
Yeah, and it's very important for people, especially with special needs and Alzheimer's, because they wouldn't be able to go through any kind of dental procedures, really, unless they had sedation.
Exactly. It's very difficult even for their caregivers to be able to get in their mouths and, and treat the oral health. So, yeah, we're able to sedate them with IV and do all their work in one sitting, and it's great for both parties.
Okay, so let's talk about the actual sedation. So you do it through an IV.
Yes.
So can you do any number of procedures?
Well, that's the amazing part, is we're able to usually do all their dental work in one sitting. So because it could be 5 minutes or 4 hours, we can usually clean up their whole mouth in one sitting, especially for patients that haven't been to the dentist in a long period of time. So we're able to do the fillings, the extractions, the root canals, the crowns, the bridges, all that in one sitting.
No more of that annoying having to return to get another couple of cavities done or whatever the case may be.
Exactly. We also have specialists on staff. So we have an endodontist who does root canals and a periodontist who does gum surgery or implants. So while they're sedated, we're able to do those procedures as well. So it's all right there in-house. We also have our own dental lab. So anything that needs to be done while the patient is sedated, we can make sure that's taken care of also. So
one-stop shopping all the way around. So let's talk about when you wake up from the sedation. Do you remember anything?
That's one of the great benefits of sedation dentistry, is they're going to have little to no memory of their appointment.
Nice.
So
bonus.
For those that are phobic and afraid of the dentist and have that fear, to not remember being at the dentist is one of the great benefits.
Yeah. Now, the beauty, I think, of this is the fact that besides the people that have the fear and the stress related to going to the dentist, is the fact that you can complete so many things all at once.
Exactly.
And so what's the maximum length of time you can keep somebody sedated to get all of that done?
The good part is because it's IV, it's not only safe and effective, but we are what we call titrating. So just giving the right amount through the IV to keep them sedated for the procedure. So if it's a simple procedure or a couple extractions, it'll obviously be a shorter appointment. If it's for rehabbing their whole mouth, it's going to be longer, but the titrated effect is what allows us to do little or a lot all at one time.
Well, I'll tell you what, this is good news for a lot of people. Thank you so much, Doctor. Really appreciate it. And if you want to relieve that fear and stress of visiting a dentist, head to happydentistry.com. There's a website for you, or call 813-DENTIST to schedule your free new patient exam. Dr. Monticciolo, thank you so much. Appreciate it.
Appreciate it, Jerry.
Cindy, over to you.